Bismillahirrahmanirrahim. Welcome to our channel, The Tooth Doctor. Today we are going to discuss about indications of tissue conditioners. That what are the conditions in which tissue conditioners are required and why they are required. So starting from the first one, condition in which tissue conditioner is required is to prevent pressure or oral tissue in the existence of denture stomatitis. That when there is a denture stomatitis or irritation due to denture, it becomes very difficult to wear denture, and most of the time patient refuse to wear the denture. So those cases we need to reduce the pressure exerted by denture, and we need to give the healing time for the tissue bearing area, so that there is a healing and patient has no discomfort when wearing denture. For this reason we use tissue conditioner on the tissue bearing area of the denture, and that reduces the pressure and distributes the pressure and provides the cushioning effects that gives the time for the healing of the denture bearing area, and also reduces the patient discomfort. So it is used in this condition to prevent the denture stomatitis, or to cure or to give the healing time in the case of denture. So tissue conditioner is used in this case. So the second case in which tissue conditioner is used is for conditioning of denture bearing mucosa disturbed by ill-fitting dentures before fabricating new denture. When patient is wearing ill-fitting denture, the mucosa gets damaged and traumatized, and for this reason, the patient is unable to wear the denture, and patient is don't like the denture and found it problematic, finds it problematic to wearing a denture. So in those cases, we use tissue conditioners to reduce the pressure on the irritation area, and also to reduce the pain and discomfort level of the patient, so that the patient can easily use the denture, because tissue conditioner provides a cushioning effect and reduces the pressure on the tissue bearing area. So denture bearing area, so it is used in this case. The third case in which tissue conditioner is used is for preventing excessive pressure on healing tissue and contributing to the healing process in patients with temporary or surgical obturators. When a patient has any surgical procedure like extraction or obturators, so it takes time for the healing of the that wound, and for that time the patient is unable to wear the denture, especially when it is hard and it gives excessive pressure. It gives excessive pressure to the denture bearing areas, and that becomes difficult for the patient to wear the denture. So in that case, we use tissue conditioners, and that provides the cushioning effect and helps the healing of these sockets, and gives the time, and also gives the patient the teeth, so that they can function use for function properly for chewing and maybe for static reasons. So in those cases when there is a surgical procedure and but patient wants a denture, so we use the tissue conditioner for the cushioning effect, so that the wound can also heal, and also there is denture in patient mouth. Next, number fourth, indication for tissue conditioner is for implant patient after surgery in order to be able to use the old denture. So when there is implant, there is a surgery, so there is a wound that requires healing. So it is the same case as of the last case, but as per evaluation and clear and it is also a clear indication that in implant patients after surgery we use tissue conditioner to provide them time for healing and reducing the stress due to danger. So it is also the indication for the tissue conditioner. Next indication of tissue conditioner, the fifth indication of tissue conditioner is as a functional impression material. This is very unique but very important indication for tissue conditioner. When we require functional impression, tissue conditioner can give a very good uh, very good functional impression, because it records it becomes hardens with time. It takes very much time to harden, but it records every muscle activity and um, every mucosa surface during functioning. And so it can is this can be very good functional impression. So we can say that it's also an indication, it may be the indication for tissue conditioner to be used as functional impression material for functional impression, to improve our new dentures, to fabricate our new dentures that comply with the functional needs of the patient, that best comply with the functional needs of the patients. Thank you so much for watching the video, and these are the five indications that are taken in the mind before we use tissue conditioners, or we consider tissue conditioner and in these cases. So thank you so much for watching our video.